Benefits of the direct anterior approach are a faster recovery, less pain, and less long-term morbidity, including hip dislocations, which have been really dramatically reduced through the anterior approach. Unfortunately, the anterior approach does have the limitation in that in certain people, very muscular people or people that have a large amount of abdominal fat, there is the concern about wound complications. So in those patient populations or in people who need revision surgery from prior surgery, it's really safer done through a posterior or traditional approach. When you're considering any kind of joint replacement, the best thing to do is come in and discuss it with your orthopedic surgeon. There are a lot of non-operative treatments that are out there, most of which we do here in clinic, but it needs to be a discussion that is handled as a team between you and your surgeon, where you decide whether or not hip or knee replacement is right for you. I always tell my patients in clinic the time they know they need a knee replacement is when they've met 3 criteria. The first is that they have imaging that is bad enough, x-rays that show bad enough disease to warrant it. They failed all the conservative care, and then most importantly, they come in and tell me, Dr. Thurman, I'm really at a point now where the pain has taken away my quality of life and I can no longer live like this. And when they've sort of met those 3, that's when they're ready for a knee replacement. The recovery for a knee replacement is somewhere between 3 and 6 months, usually for total recovery. The first 2 weeks are the hardest. It involves healing from surgery, controlling pain, and getting through therapy. After about 6 weeks of therapy, most people are on their way to full recovery, but we really see that last bit of recovery occur in the final 3 to 6 months. Recovering from knee replacement surgery does involve modifying your lifestyle once you're healed. So I have always said to especially my active joggers that it's really not best to be running on an implant. We encourage people to stay active. However, they often usually have to modify from more high impact exercise to things like bicycling, swimming, ellipticals, or weight training, leaving hiking and running in the past. Hip or knee joint replacement surgery is a very personal thing, and it's something that should be discussed with you and your surgeon. There are options including different approaches to hip replacement surgery that are best discussed with you and your surgeon. And there also are partial and total knee replacements, and those are conversations that really depend on what your x-rays show, where your pain is, and what kind of treatment you've tried.